So, John has now received a diagnosis of neuropathic pain, and the doctor has explained the illness and symptoms at hand. Now both John and his doctor must work together to find the best treatment strategy possible. As the doctor explains, neuropathic pain is often difficult to treat effectively, with only 50% of patients achieving significant pain relief. Because of this, it represents a large unmet need in the healthcare system. Abnormal sensations due to damage or changes in the nerves may not always require treatment and may resolve on their own. Some nerve pain is a result of inflammation of the nerve and can be treated with over-the-counter painkillers such as paracetamol and ibuprofen. However, John has already tried these to no avail, so he will likely need prescribed medication that acts on the nerves themselves. There are many different types of nerve medications with risks and benefits to each. These include antidepressants, gabapentinoids, opioids, and topical treatments. If John begins these medications, he needs to wait up to 6 to 8 weeks to feel any better. After this period, if John is still in pain, the doctor will discuss a change in treatment approach. This could involve adding or switching medications or trying alternative treatments. Some antidepressants are often also effective in treating neuropathic pain. The most commonly prescribed antidepressants for neuropathic pain are amitriptyline, nortriptyline, and duloxetine. They work by changing the amount of nerve transmitters in the nervous system, with the ultimate effect being a reduction of the pain signals being registered by the brain. The mechanism they use to do this is independent of how it treats depression, however, it is still poorly understood. Although some pain relief may be felt after 2 weeks, it may take up to 2 months to reach full benefit. Main side effects include drowsiness and dizziness, which may be difficult in jobs that involve concentration for long hours, such as driving. This medication also cannot be taken alongside alcohol. Gabapentinoids are another class of drug used in treatment, also called antinociceptives. The most common gabapentinoids are pregabalin and gabapentin and are traditionally used for epilepsy. However, there is strong evidence supporting their use in neuropathic pain. These medications work by acting on the nerves directly to reduce the transmission of pain signals across the pain pathway. These medications may start showing benefits within a few days, however may also take up to 2 months for its full effects in reducing pain. Again, when starting this medication, alcohol should be avoided, as drowsiness is often a side effect and can be worsened whilst drinking. It's important to note that gabapentinoids have recently been on an upwards trend for addiction and misuse, and therefore have been recently rated a Class C drug in the UK. This means that they should be very carefully prescribed and monitored in chronic pain. For both antidepressants and gabapentinoids, dosage is prescribed in a trial and error method in a process called titration. This means the starting dose is slowly increased until the correct balance is found between maximum pain relief and minimal side effects. Opioids can also be considered for neuropathic pain relief. They can be prescribed according to the World Health Organization's recommended pain ladder. Prescribing starts with weaker opioids such as codeine and can go all the way up to morphine and oxycodone. Unfortunately, opioids are well known for their addictive properties, highlighted by the opioid epidemic in the USA. Therefore, they must be prescribed extremely carefully to avoid dependence and substance abuse. This means the strongest opioids are often only suitable for short-term acute pain. Opioids should also be avoided in those with a history of substance abuse or mental health problems. As well as this, they are not often as effective as other treatments in neuropathic pain. Instead, there is evidence that the medication tramadol, which works in similar ways to both an opioid and an antidepressant, is more successful than normal opioids in treating neuropathic pain, so should be considered first. John is first prescribed amitriptyline. He begins to take daily doses in the evening. He tries to adhere to the medication, however, after 8 weeks of increasing his dose, his symptoms have not improved at all, and he has become extremely drowsy throughout the day. He returns to the clinic where the dose is reduced and he is prescribed duloxetine. 4 months later, John has tried multiple medications and has either not tolerated the side effects or not felt any significant pain relief. By now, John's chronic pain has severely affected his mental health. His inability to walk or exercise has led him to become very reclusive, and he has lost his job. He has also stopped attending many of his appointments, leading his wife to call John's pain specialist and take him to the clinic herself. At the appointment, John explains to the doctor he has given up on finding a relief from his chronic pain and has stopped taking his medication regularly. John's wife asks if there's anything that can be applied to the skin directly, instead of taken as an oral medication to reduce the side effects. Topical medications include lidocaine and capsaicin. Lidocaine is an analgesic agent that can be applied as a plaster to numb the painful area. Capsaicin is a component found in chili peppers and can be applied as a cream to block pain signals from nerve endings. These both could be used if John's pain was more localised, however it is spread out over his feet and legs, so this is not ideal. The doctor explains to John why it's so important to carry on taking the medication regularly and discusses other pain management techniques outside traditional medication. These include psychological therapy, known as cognitive behavioural therapy or CBT, to provide coping strategies for his pain, both physically and emotionally. Physiotherapy of the legs and feet is also an option, as well as creating a fitness and exercise regimen to overcome the pain. These treatments could all potentially benefit John alongside his new oral medication, pregabalin. John agrees to these new approaches and becomes freshly determined to overcome his chronic pain for good.